So I spend a lot of time alone. Throughout the day, I'm on my own. I have a dog and cats and stuff like that. That kind of they're kind of you might keep me company and stuff like that. But I never actually feel lonely. I'm really happy with my own kind of just my own self. You know, taking time for me time, basically. And I know a lot of people find being alone difficult. It's difficult for their mental health and stuff like that. There was a time that I went through that. Um, but after, I think it was after like COVID, I kind of got into this situation where okay, it's just me during the day, kids at school, wife's at work, it's just me. I didn't really go out that much, you know, after COVID, let alone, during COVID. So I was kind of just left alone with my own thoughts, I guess. Now, I, as far as mental health goes, my depression was a lot worse than it is now. So those thoughts that were with me all day, every day, were very different to what they are now. For example, I'm not saying you know it's gone. It's depression is always going to be there. I take medication for it. I have low days. I don't tend to post anything on low days or anything like that. I usually wait for the good days and post stuff like that up there. But what I'm getting at is that when I am on my own, I'm totally fine with it. Um, and the way I got to this place is that I kind of broke through like a barrier to be okay on my own. It may have been the change of medication, I don't know. Um, but just after COVID, say 2021, changed medication, it kind of, you know, eased up a bit. It's probably the best way of describing it. Um, but yeah, it's just a kind of. I'm not saying I'm in a happy place or anything like that, but I'm certainly not in an unhappy place with my own, uh, you know, personality kind of thing. Um, I mean, you guys may find me really boring. I don't know. Um, Sometimes I get bored. That's probably as far as things go. But I've got the cats and the dog to keep me. There's the dog right there. Sleep on me. Um, and I've got those guys to I guess keep company. I also still try and play the guitar as much as I possibly can, but fingers don't quite let me do as much as I want to. So, yeah, mental health, I think, is. I'm kind of rambling on a bit here, I guess. Um, but mental health for me changed over a period of time. It didn't get better, it just got less worse. And I think that's the way to describe things. Sometimes they don't get better because they can't, but they can certainly get less worse. Also, you can work alongside things to help. Um, and seeing people like a psychologist has really helped. Sort of my journey throughout there. And that's exactly what it is. It's a journey. It's not just a like, bang, that's it, you know, job done. It's every day is different. Every day you take a different step at a time and you just see where you are on that day. It's as simple as that. You know, if you have a bad day and you don't feel like doing anything, don't do anything. Be in control. That's probably what my suggestion would be. Well, I'm not a doctor, but you know, by controlling things and you being in control of things, you get to decide what you do, when you do it, but more importantly, what not to do. So if you want to have a day off from thinking about things, have your day off. If you want to phone in to, if you're working and you're not feeling up to things and you have the ability to phone in sick, just phone in sick. You know, your mental health is really important. If you don't look after it, so if you don't take that one day off, the following week, you might have to take 5 days off. So that 1 week, or that 1 day, sorry, is the lesser of two evils, you know, as far as taking time off work goes. Plus, I know some don't, but workplaces should be supporting mental health as well. If they don't, then they're a bit naughty. But yeah, I don't know really why I made this video. I just kind of wanted to just put it out there, really. But there we go. Have fun for the rest of the day.